the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. Thanks for making time to join us this afternoon for our monthly Thrive Kentucky policy update. Many of you have been on these updates before, and I always like to just start with a little bit of information about Thrive Kentucky and what we do. As always, I have a little trouble advancing my slides if it gets started. Okay, here we go. So our Thrive Kentucky campaign is a group of, we're a coalition of organizational partners working together to strengthen our safety net and make it more equitable. And we do this with the principles that you see here on the slide, really working on policies that are anti-racist and anti-poverty that will help all Kentuckians thrive. And so this is our list of steering committee members. You're probably familiar with many of our organizations by now. And this is the agenda that we're going to cover today. So before we start with the agenda, I just want to do a little bit of housekeeping. We have a lot of folks that are joining the webinar probably right now, actually. So be sure to mute your line and keep it muted. If you have a comment or a question, feel free to put that in the chat box throughout the presentations. We'll try to stop at the end of every section and cover any questions or comments that you have. And we are recording this webinar today. So we will send out a link to the recording. We'll send out the slide deck and any other resources or materials that we talk about today in a follow-up email along with an evaluation asking for you to tell us what other information and topics you want us to cover. And like I said, as people are speaking, just feel free to use the chat box. That's the best way for us to know what people have questions about. If we are using an acronym or saying something that you're not familiar with, we'll be happy to expand on it. And we are also offering CEUs for licensed social workers and certified CHWs. So you can contact me or Kelly Talby. We'll have her email address at the end of this presentation if you want that credit. So with that, I'm going to turn it over to Dustin to start us off with an economic overview.
Hey everybody, I'm Dustin Pugel. I'm with the Kentucky Center for Economic Policy. We're a nonpartisan, nonprofit research organization based out of Berea, but we've got folks all over the state right now since we're all working from home. And so, you know, in each of these webinars, we have started off with just giving some background on what is going on with the economy, because that really sort of sets the stage for the need for public assistance and for federal relief and all of the other things that we're going to talk about during our webinar today. So we'll just jump right to it. I always start with this slide because I think it's really important to realize just how historically bad this downturn has been. If you look at the line graph here, you know, this little blue line has that initial dip, which was the recession that started in 2001 and then, you know, very gradually returned to normal right before that second dip, which is actually the Great Recession. You know, it had been the worst, at that time, the worst downturn we'd experienced since the Great Depression. And after that point, Kentucky saw really a pretty consistent growth in jobs all the way up until March of this year, and then really April, which is what that radical drop in employment is. Since then, we've had a fairly steep recovery that you know, sort of roared back in May and then again in June. But really since July, it's sort of tapered off. In September, we only saw job growth of a few hundred. In October, we saw job growth of about 10,000, but that still meant that we were 10,000 jobs shy of where we were in February before this started. And again, just to put that in context, you know, even after several months of recovery, we are still only just now where we were at the very bottom of the Great Recession. 100,000 jobs fewer in October versus February really represents an enormous amount of hardship for folks. And we're going to talk about that hardship, but just some top line information. 40% of Kentucky adults have reported losing household income since March. About a third of Kentucky adults have mentioned difficulty paying rent or reported food insecurity, basically having difficulty putting enough food on the table. And we know that a large number of people, up to 200,000, have lost health insurance, so through their employer. So, what this represents is really just a unprecedented level of hardship that we're still in here in October. We're not talking about April anymore. We're months into something like a recovery, even as COVID cases surge and there have been additional rounds of shutdowns. So, just a few other metrics here. We've sort of gained back 66% of jobs, about 2/3 of jobs since when we bottomed out in April, but that still leaves us 5.6% below where we were in February. So let's move on to the next slide. I think it's also to point out that the pandemic and the subsequent downturn has not been equal among all Kentuckians. It's fallen disproportionately hard on Black Kentuckians. In normal times, Black Kentuckians actually have a higher workforce participation rate than Kentuckians on average and white Kentuckians. But during the downturn, they have experienced higher unemployment. They have always experienced lower wages. There's been less opportunity to get paid leave, including paid sick leave. And they've also had higher exposure to COVID-19, partially because of the professions that disproportionately hire Black Kentuckians and other Kentuckians of color. But also, we just know that there are significant inequities in our healthcare system that have led to, just inadequate care for those who have gotten it. This bar chart shows the reduction in unemployment insurance claims by race. So whereas in total, there's been a 40% reduction in unemployment claims between September and April when it was at its highest, and 43% for white Kentuckians. There's only been a 20% reduction for Black Kentuckians, which suggests that it's been a lot harder for Black Kentuckians to find jobs than it has been for other Kentuckians. So let's move to the next slide. The job market has also been disproportionate. So if you're a high income earner, the employment market dipped a little bit there, like it did for everyone, starting in April and really basically recovering in June. And it stayed more or less about where it was in January since then. As of September 30th, I know it says September 3rd in the chart, but it's actually a slightly older chart. As of September 30th, almost 1%, there are almost 1% more jobs for high wage earners than there were in January. But in total, actually that total number should be middle wage earners. I just mislabeled that. Middle wage earners is actually 4% below. In total, it's nearly 6% below where it was in January. But for low wage workers, it's almost 12% fewer jobs that they're facing. And again, a lot of that's a product of the type of employment, leisure and hospitality, so hotels and other types of recreation, food service workers, and other types of low income jobs like temp work. Those are the ones that have really not recovered since April and are really, it's a tough job market if you are a low wage earner. So let's go on to the next slide. I'm just going to sort of transition into unemployment insurance because that really relates to directly what's been going on with the jobs market. And there are some really concerning trends that we're seeing. So, as we've said many times before, unemployment claims surged in the beginning of March and really stayed high all the way through April. Prior to the pandemic, average unemployment insurance claims per week were around 3,000. For the entire month of April, it was over 100,000 on average. And while that did drop off quickly, they remained pretty elevated all throughout that time. Only just in the last couple of weeks have we seen them start to tick back upwards again. So we had gotten down to around 5,000 claims per week, which is around where we were in January, actually. But this actually on Thanksgiving Day, when the U.S. Department of Labor released new unemployment insurance data, that was the first time in weeks that we had been over 10,000 claims. So I anticipate, that was actually before the additional rounds of shutdowns were announced. So I anticipate that number will continue to rise. Pandemic unemployment assistance, which is that special program that was put together by the CARES Act for gig workers, independent contractors, business owners, as well as folks who either got COVID or were advised to stay home because of COVID, or their childcare or school was shut down because of COVID and they couldn't go to work. That program has actually stayed pretty high. It started to drop off because some people are beginning to exhaust their benefits. There's only 39 weeks of PUA available to folks, and it started in February 8th. So we're actually seeing the initial group of folks expire their benefits. And then PEUC, Pandemic Emergency Unemployment Compensation, is an additional 13 weeks of benefits for folks who receive regular unemployment insurance benefits and PUA. And that number has been steadily climbing as people have expired their regular benefits. So right now, that's just shy of 30,000 claims. We'll come back to both of those programs in a little bit, but I think it's just important for now to show you that there are a lot of Kentuckians who are currently using those benefits. Combined, little around 70,000. No, almost 80,000. So let's move on to the next slide. So as I was just mentioning, there are several unemployment insurance programs that are expiring. This chart here shows the dark bars are that extra $600 per week program that Kentuckians were receiving from March all the way through the end of July. And they brought billions of dollars, actually around $3.3 billion into Kentucky over the course of its effectiveness. So it expired July 25th. President Trump then diverted FEMA funds to a different similar program called the Lost Wages Assistance Program, where the federal government offered $300 and states were then required to kick in an extra 100, which we did using coronavirus relief fund monies that were also from the CARES Act. And that brought in, around, I think a total of about $80 million. It could be a little more than that. I don't remember off the top of my head. But just to say that it didn't go very far and it only lasted for 6 weeks. When that expired, essentially people have just been receiving their standard benefit for regular unemployment insurance, or half of that amount for pandemic unemployment assistance. Right now, the average weekly benefit for regular UI is about $281 per week, which is far below what most family budget calculators would say you need for a modest but secure livelihood, and it represents roughly 50% of lost wages. Pandemic unemployment assistance is basically pegged at 50% of what your regular benefits are. So, gig workers, business owners, people who have coronavirus and had to leave their job for that reason, they're now receiving about 25% of what they were earning before. So it's a very, very paltry amount of money to try and survive off of, and yet we still see tens of thousands of people utilizing those programs just to get by on. So, several of these benefits have already expired. We already mentioned PUC and the Lost Wages Assistance Program. But additionally, there's another 13 weeks that is federally funded through what's called extended benefits. So you have your regular unemployment insurance benefits that last for 26 weeks. And then the pandemic emergency unemployment compensation kicks in for an additional 13 weeks. And then after that, there's an older program called extended benefits that the state has statutes around for who can get it and for how long. That was turned on based on our unemployment rate, but for a variety of weird reasons, it actually turned back off because the way for a lot of weird technical reasons. It expired. We can get more into details if folks are interested. But what that meant was that nearly 5,000 people immediately lost their benefits. And it's unlikely that that's going to be turned back on anytime soon, certainly before the end of the year. So in addition to those 3 programs that have already expired, there's 2 more programs that are set to expire the day after Christmas, December 26th. The first is PUA, that special program that we've talked about that, we know that nearly 50,000 people are using right now. And the second is pandemic emergency unemployment compensation, that extra 13 weeks that kick in as soon as your 26 weeks are up. And that is set also to expire the day after Christmas. So based off some estimates from the Commonwealth Fund, we know that over 100,000 Kentuckians will have lost their benefits either before or by December 26th, which is a lot of money, not just for family budgets, but also for the economy in general, which could potentially lead to further layoffs as people aren't spending as much, and that slows down, other businesses' ability to make and sell the things and services that people are buying. So it is very concerning. It's encouraging to hear that Congress is taking the expiration of these programs a little more seriously, and we'll get into that later in our presentation. But for now, I just kind of want to leave us with that. So let's move on to one more slide, and I'm going to do this quickly because I think I'm going over my time. I just wanted to mention quickly that people have probably heard Kentucky has taken out a loan to pay our regular unemployment insurance benefits. So far, we've borrowed $487 million. That's about half of what we borrowed during the Great Recession. We are authorized to borrow up to $865 million, which is still less than what we borrowed during the Great Recession. We paid the loan off that we took out during the Great Recession in 2015. And so we had been building up our unemployment insurance trust fund that we make payments out of since then. And we never really got back to solvency before this crisis hit, which is why we needed to take out more. So in order to pay that back, there will be a modest increase in employer taxes. And I say modest because this chart here is hard to see, and that's kind of on purpose. This is basically to represent how much more employers will have to pay in taxes. There's 5 little blue dots up in the top corner there. That is the percent of business sales that businesses will have to pay in terms of, or the equivalent of business sales that businesses will have to pay down the loan. The lighter blue dots around that are the percent of total wages. So essentially, it is a very small and fixed amount of money that businesses are going to have to pay. There's also a small incremental increase in what they'll have to pay the federal government to pay back that loan. But all that to say, it is if we want to make sure that we are ready for the next recession, which is going to happen, I'm sure, sooner than we would like, we need to make sure that we're getting our unemployment insurance trust fund ready now when we can, rather than wait until it's too late and we have to take out another loan. So again, I'm happy to answer more questions about that, but for now, I'm going to go ahead and hand it off to Whitney to talk about evictions and housing assistance.
Thank you, Justin. I'm Whitney Reynolds with the Homeless and Housing Coalition. Just a quick recap of who HHCK is. We're a statewide advocacy group dedicated to eliminating the threat of homelessness and fulfilling the promise of affordable housing. Not a lot to update on the CDC eviction order. Just a reminder that it went into effect September 4th, but we are nearing the end of it. It is set to expire December 31st as of right now. A covered person is someone who does deliver the declaration and obviously signs the declaration, so giving that to their landlord. I think we'll go on to the next slide. HomeRenterDeclaration.org is a site that Kentucky Equal Justice Center has up, and it's super helpful. at this site. You can review, sign, and email the declaration all in one stop. It gets delivered to your landlord. If you're working with folks who need to utilize the declaration, this is the place to do it. Legal aid is helpful and is key if there's a landlord that's not participating or says they're not participating, because it's not optional to not participate in the CDC declaration. I'm just going to emphasize the homeowner-declaration.org is the place to go. It shows you everything that you need to do. It recaps the CDC declaration, uses simple language, and it also has it in several different languages for folks that need other languages besides English. Go on to the next slide. We have some flyers that we've been trying to distribute. We still have lots left. If you are interested in not only downloading them from our website, but we also can get some out to you that are on Post-it pads. You can email me directly, or you can go to our website or to KJC's website to place an order for those, and we can get those out to you. Obviously, it's time sensitive at this point because we're running up against that deadline of the end of this month. I think we'll go to the next slide. So the folks that are at risk of evictions right now, this is 211 data from Metro United Way. And I know this is a little bit hard to see, but if you're looking at the top line there, the highest number percentage that folks are calling to ask for assistance continues to be housing and shelter. So 37% remain for housing and shelter. That's an increase from last month. Of the housing and shelter requests, 68% were for rent assistance. That continues to be an increase from last month as well. I'll maybe let folks look at that for just a second, and then we'll go on to the next slide. We don't have a statewide 211, so that's where we're pulling from Metro United Way. Some more data on people at risk of evictions. 15% are behind on rent. 20% of Black homeowners are behind on rent. 7% of all renting households have no confidence in ability to make next month's rent. 13% of Black homeowners report the same. 32% of all homeowners think it's somewhat likely to very likely they'll have to leave their home due to the eviction in the next 2 months. And 34% of Black homeowners report the same. This is census data if you wanted to look up some more or to have those for yourself. And next slide. So how can folks get assistance? So statewide applications closed at the beginning of last month. Lexington, there are still applications available of what's left of the less than 1.5 million that started, and Louisville applications are still available at stopmyeviction.org. And they started out with 21 million in Louisville. And if you guys want to leave that up for just a second, or not, it's okay. And then lastly, HHCK is, we are trying to gather some stories of folks who have been affected by COVID-19 and their shelter and their housing situation. So if you're working with folks who are willing and want to share their story and maybe even be connected to reporters or just other case managers and folks that can connect them, we are willing and able and here to listen. So we've got that link up at our website, hhck.org. It's on our homepage. We would love to hear from folks. And that's all I've got today. So thank you. And I will pass it on. I'm sorry, I don't remember. Okay, sorry, Jessica.
Thanks, and hi, I'm Jessica Klein, Policy Associate at the Kentucky Center for Economic Policy. I'm going to talk a little bit about some advocacy opportunities with the Food Policy Network, and then a couple of updates on our food assistance programs. So first, I just wanted to mention the Kentucky Food Policy Network. It's a new and renovated network that's a partnership between Feeding Kentucky, Kentucky Center for Economic Policy, KEJC, who's also on this call, and CFA, the Community Farm Alliance. So we are working on all things food, farm, and hunger policy. We currently have 4 different working groups that are meeting on a quarterly or monthly basis, depending on the group. And they're listed here. So Food and Nutrition Assistance Programs is the one that I'm leading, having to do with SNAP and WIC and other nutrition programs in Kentucky. The others are climate change, food and agriculture systems, some more systemic policies, and then childhood nutrition. So if you're interested in learning more or participating, you can find more at CFA's website below. Next slide. And then I kind of wanted to bring it back to SNAP and a few updates there. SNAP is our Supplemental Nutrition Assistance Program, also known as food stamps. We've continued to see increases in participation to that program, over 133 since February, 133,000 additional Kentuckians since February. So that's over 600,000. You can kind of see that big increase right there, and that's kind of when the pandemic started, towards the end of this map. So you can see that there. But yeah, our largest increases are both in Louisville and more rural counties across the state. So it's really spread out. But even beyond this, we know that SNAP can't feed every Kentuckian. So there are more policies that we need. So on to the next slide. So a few flexibilities that the state has taken on since the beginning of the pandemic. One is the emergency SNAP benefits, which increases to the maximum amount for your household size. That's just been approved for December. So it's been every month since April that we've been able to provide that. So that's good news. And then recently in the CR, we have applied for these waivers. There's been extension for each of these waivers, but still waiting to see that they're approved. So a few of those include reestablishing extensions for recertification, so people don't have to go into those in-person appointments to reapply, minimizing in-person appointments, being able to do things like self-verify income over the phone, and minimizing appointments for WIC, which also has a lot of requirements around going to doctor's offices and labs. So that's super important as well. So the one thing we would still like to see, though, is an increase of the maximum SNAP benefits by 15%. And the reasoning behind that is the emergency SNAP benefits we mentioned increase maximum amount per household. But if your family is already at the maximum amount, they don't see an increase. So we'd like to see an increase of 15% for those folks. Next slide. Now I'm going to get a little bit into the pandemic EBT, P-EBT program. I know this has had a lot of confusing communication over the past month, so I'm going to try to clarify some of that. So this is a picture of the card, just to clarify. And over 625 students are 625,000 students are eligible in Kentucky for the August and September version of this program. That was the second round of P-EBT for Kentucky. And that went to schools that participated in free and reduced lunch, but also to schools that provided summer meals programs in the past year. So that's kind of a bigger group than had previously received the first round of P-EBT. And this pays for the missed meals during August and September, during missed school days during that time. So that's up to $250 per household. So again, this is for the August and September version. The deadline goal was November 20th, but some cards are still coming out in the mail. So next slide, and I'll talk a little bit about that. So this is what the envelope looks like. It's very plain. It's just a white envelope. It could say it's from a different state as well. Each child was mailed this card automatically in an envelope like this. So individual children would have received separate envelopes and separate cards with their name on it. Again, the goal was November 20th, but due to holiday mail, some of these are still coming out, is what I'm hearing. And for those who feel like they don't need this, but have received this card, You can still use this for your family's groceries. And then what some people have been doing is donating an equivalent amount to a local food bank or by calling their Friskies resource officers to learn more about how they can help out their school. Next slide. So that was for August and September. Moving forward is the October version. So this is the round 3 of this program that's coming out soon. So it hasn't started yet. And DCBS is currently working on our plan. They recently received some guidance from the USDA of how this new version should be implemented. So they're working on that. This new version will be for students that participate in free and reduced meals at school and whose classrooms are either all virtual or have 5 days virtual in a row. And that 5 days will determine the amount of money that they receive. This program will also be expanded to younger children in child care centers. We're not exactly sure which child care centers will qualify just yet. So that's something to look forward to is additional children will receive these benefits if they need them. And then the CR, the continuing resolution that approved this program for the 3rd round, also provided federal funding to administer the program. So that means more resources are going to this program to ensure that it's implemented correctly. I think that's it. I can turn it over to Emily if there's no questions.
Great. Thanks, Jessica. For those of you who joined late, I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health, and I'm going to give you some updates on health coverage and open enrollment today in the ACA lawsuit. So some health coverage updates to start. With Medicaid, I think we may have shared this information on the last call, and with the forum that we did with the Cabinet for Health and Family Leadership, Health and Family Services, but we are going to have 0 copays in 2021 for any Kentuckian enrolled with an MCO. That's a Medicaid managed care organization. This is something that we've been advocating for a long time. For many years after managed care came into Kentucky, most of the MCOs waived copays, or they waived almost all copays because it just made the most sense. Copays tend to reduce utilization of really important services, and people end up rationing their care in ways that isn't, leading to better health. And so MCOs and providers both feel pretty strongly that copays aren't useful with the Medicaid program. And so then back in 2019, you'll remember that on January 1st, copays were made mandatory. And a lot of people ended up being turned away and did not get the services that they were seeking, or they just chose not to even seek services because they didn't have that money in their pocket when they needed those services. And so this administration has decided that they don't want Medicaid copays to be a barrier. And MCOs have all agreed for the plan year 2021 to eliminate copays. Now, they're not yet eliminated in statute, but that's something that we're working on too. For now, any Kentuckian covered by fee-for-service Medicaid, that essentially means you're covered directly by the state, not through a managed care organization. There will be these, what they call nominal $1 copays for 3 types of services: pharmacy, non-emergency use of the emergency room, and non-emergency medical transportation. Or maybe it's non-emergency use of an ambulance. I'll have to double check on that. But once you spend $1, you have hit your copay limit for the year, your copay max, and you won't be charged copays any longer. So basically, you will be charged $1 for the year. And that's a real, that's progress for Kentucky. And I think it's going to make a big difference for a lot of Kentuckians. But like I said, we're still working on a permanent solution, which would be statutory. And then there's going to be one universal formulary for all providers and MCOs starting in 2021. This is huge too. Since managed care came into Kentucky in 2011, each MCO has had a separate formulary. And then of course, fee-for-service Medicaid has had their own formulary. And that's led to just a number of issues and people not getting the medications that they need, and just more administrative burden on providers and pharmacies. So that's a huge win. And right now, there are no prior authorizations during the pandemic. There are no prior authorizations being required through the end of 2020. Now, early on in the pandemic, prior authorizations were suspended. They got put back into place for everything but behavioral health services. And then they've been suspended again because of the recent surge in infections. And so looking at commercial insurers, or really just all insurers, whether public or commercial, it's important to remember that COVID-19 testing should be free. And we've talked about this on a few of our webinars, but what we keep hearing is that people are being balance billed. And balance billing is pretty common. It often happens because maybe they're charging you some sort of administration fee or some other fee for your visit. But that test should be free, and you should not be charged if the visit is for that test. So if that's happened to you, or if you know it's happened to others that have gotten tested, there's a great blog that Kentucky Equal Justice Center put out. You can see the link there, and they also have a form that you can use to submit to an insurance company and say, you know, this isn't a fair bill and I shouldn't have to pay it. If that doesn't work, the Department of Insurance also has a complaint form. And then just because we've recently heard the excellent news that there is a COVID-19 vaccine that is coming to Kentucky soon, not for enough Kentuckians yet, but we will have our first round coming sometime, I think in December, for people in long-term care, for some healthcare workers. Vaccines should be free for everyone. They should be covered, but we expect to see some similar issues. So once we have a better idea of how that's playing out, we'll share more information. I also wanted to share, because this is open enrollment for marketplace plans for Medicaid, and I believe we're still in the Medicare open enrollment, but really this buyer beware slide is for those who are seeking some sort of commercial insurance and are looking at options perhaps on the marketplace, which are really regulated by the Affordable Care Act completely, or other options that may be offered off the marketplace. And so we call this a buyer beware because there are plans that are short duration plans that are basically junk plans, and they are really proliferating. We have more than 20 insurers offering these types of plans in Kentucky for 2021. So there's been a big growth. Back in 2018, the federal government the Trump administration decided to expand the time that these plans could cover someone. So they have in the past been very brief. They've been considered gap coverage, and often it was limited to 3 or 6 months at a time. They've been expanded to 12 months of coverage, although that's technically 364 days, for up to 3 years renewal. But these plans come with a lot of loopholes and a lot of limitations. The thing that is really attractive about these plans, and that can often get someone to enroll, is that they have a lower premium, a lower monthly premium, but the out-of-pocket costs are tremendous if you do use your coverage, and many benefits are not covered. Or if you have a pre-existing condition, your condition may not be covered at all. It may not be covered for the first year. You may have to pay premiums for a year or more before they'll cover certain things. And the bottom line is they really aren't going to cover you when you need care. But the marketing can be fairly misleading. We call it, deceptive marketing. And people often are just confused. They see these plans, they don't read all the fine print, or they don't understand it all because it's confusing, medical jargon. And they end up enrolling in something that isn't going to cover them when they need it. So just be aware that these plans are out there. And when people are Googling, if they don't go directly to healthcare.gov, if they're Googling around for insurance, a lot of things pop up that aren't comprehensive coverage and are not subject to the Affordable Care Act requirements and consumer protections. And just as a reminder, we have 1.8 million Kentuckians with a pre-existing condition. So it's common, and it can lead to people really being shut out of care. So other open enrollment information, you can see the dates for open enrollment here. Medicare is close to ending. We have Marketplace and Medicaid open enrollment through December 15th. With Medicaid, it's important to know that this isn't the only time of year that you can enroll. This is just the time of year that you can change from one MCO to another. So this is when you want to see what each MCO is offering and make a choice that's best for you and your family. And there's some information on the screen about how to make that change. For Marketplace coverage, there are 2 insurers that are offering plans to Kentuckians this year. They're not all statewide, so you can click on that link to see the coverage maps. There have been some rate increases. This is common year over year, unfortunately. We are hoping that with the state-based Marketplace in place next year in 2021, that we will have more competition, more plans offering plans on Connect, on an integrated state-based Marketplace, and that by having more competition and also more options as a state in terms of how these plans are designed, that we'll have some more affordable options. And anyone who needs help with a Medicaid application or a Marketplace application, comparing options, shopping, there is a link to find an agent or a connector in your community. Oh, this is a terrible graphic. I'm sorry about that. This is a side-by-side image of the various Medicaid managed care organizations, the 6 MCOs that we have here in Kentucky that are going to be offering plans for 2021. And you can click on that last link that says side-by-side PDF and get a clean copy of this that is readable. But what you'll see here are the extra benefits, the extra covered services that go above and beyond what's required of the MCOs. So these are things that are often really popular and necessary, needed by Medicaid enrollees, like glasses for adults and sports physicals for kids, things that aren't covered by Medicaid, but the MCOs choose to do it. So that's good information, helps people make the right decision for themselves and their families. And for other details about the network, you can go to the links that are on the right-hand side of this. I also wanted to let you know that there's going to be an event on December 10th called Get Covered 2021. This is a national event, but Kentucky is participating, and you'll be seeing a lot more information about it in the coming days. But we just love your help spreading the word, really making sure that everyone knows that this is the time to enroll in coverage. The information, the data that Destin shared earlier about people losing work and losing income during this pandemic, and people very near to losing even their unemployment benefits in a few weeks. More people are going to need coverage, need affordable coverage, whether that's Medicaid or subsidized plans on the Marketplace. And so we want to make sure everyone is covered during this pandemic so that they can get the care that they need. And along those lines, just a reminder that Medicaid during the pandemic, Medicaid coverage is available temporarily for people with incomes above 138% of the federal poverty level, which is approximately $17,000 for an individual. So right now, if somebody is over that income limit, they can still apply for this temporary coverage. It can cover you for up to 90 days. And there's the option of applying twice in 1 calendar year. So that could cover you for nearly 6 months. There's information here and flyers that you can share with your networks. And I wanted to end with a little bit of information about what's going on at the federal level with the ACA lawsuit. You probably heard that the Supreme Court heard oral arguments on November 10th That was actually when the last Thrive Kentucky webinar that we did. It was happening basically at the same time. And I think we're all aware of what's at stake, but it's important to remember, like I said, 1.8 million Kentuckians have pre-existing conditions. If we were to lose the ACA, we would see an increase in our uninsured rate of 184%. We'd be one of the highest states in the nation in terms of an increase in uninsurance. We would see over 500,000 Kentuckians lose coverage. That includes 52,000 kids. A lot of people assume kids wouldn't be impacted by this, but they absolutely would, as would their parents. And Kentucky would lose $4.3 billion in federal funding each year. And to imagine a loss like that during a pandemic and recession, it would be devastating to Kentucky and to our hospitals, in particular rural hospitals, which we would absolutely see their doors closing. So for all of those reasons, it's important that we keep the ACA, improve on the ACA, and we have many ways of doing that. Congress has the option to fix this, so I'm just going to start there. But the good news is that with those oral arguments, it really seemed that the justices were not buying the argument that the ACA isn't constitutional. So this lawsuit came about because the individual mandate was taken down in 2017. The Tax Cuts and Jobs Act reduced the tax penalty, that mandate, to $0. But Congress did not. In fact, Congress voted 5 times in 2017 to repeal the ACA, and it was not successful. The repeal was not successful, so the ACA stood. So, the argument on the other side is Congress did not intend for this to make the ACA unconstitutional. And 6 justices asked questions that really pointed at that, the fact that Congress has not voted to repeal the ACA, or has voted but has not succeeded. And that 6 justices also made clear references to the mandate being severable, that the ACA could stand if the individual mandate is 0. But again, more importantly, Congress can fix this by restoring the mandate to its original amount or to $1. And there are many other things that Congress could do to make coverage more affordable under the ACA and expand it to more Americans. So I'll stop there and turn it over to Marcy Timmerman.
Hi, everybody. I'm Marcy Timmerman, Executive Director of Mental Health America of Kentucky. If you want to go ahead and skip the slide forward for me, somebody. Thanks. We are dealing with 2 pandemics, COVID-19 and racial injustice. Both were present, and they are presenting some significant mental health challenges to all of us. They will affect all of us, although we may feel it and express it differently. Keep that in mind, that everyone does express and feel stress and change differently at different times even. We all have different symptoms at different times. Anxiety and depression will be the most common symptoms in all age groups, including our children. We're seeing more calls to crisis helplines, more overdoses, more suicide attempts during these pandemics. So please check in on your loved ones and do it regularly, including the people who you think are okay. All of us should try to get daily exercise, stick to some routine, minimize alcohol use, and reach out to connect with others. Talk about how you feel, listen to people, get help if you feel overwhelmed or desperate. Help is available. You can call the crisis line at your local community mental health center. You can find that at mhaky.org and get help, or call the suicide prevention helpline at 800-273-TALK. That's 1-800-273-8255 for immediate counseling. Help is available, especially through telehealth right now. Go ahead and skip the slide forward. There is a policy that we want to talk about, the SUD waiver. That's substance use disorder is what SUD stands for treatment during incarceration. The 2020 Kentucky General Assembly, Department of Medicaid Services was asked by them to work on an amendment to an existing waiver that already was around for substance use disorder treatment to Medicaid eligible individuals. If approved, this waiver will provide treatment during the pretrial period if the person is incarcerated while waiting trial, and will continue until the time of discharge from any sentencing, with Medicaid reimbursing for substance use services during this entire time. Hopefully, that will also help the individual to seek recovery and other services once they are back in the community. The goal with this is to stop that revolving door constantly of people going to jail because of their substance use issue. We want to actually treat them. If approved by CMS, Kentucky would be the first state in the nation to develop and implement such a program, and we're pretty positive about that. The state public comment period ended, and the final proposal will be submitted to CMS soon. I haven't seen it yet today, but there will be a federal comment period coming up as well after that final proposal. So stay tuned for information from us on when that opens. And there's also a single Medicaid formulary being written. It's from Senate Bill 50 in the 2020 Kentucky General Assembly. Formulary is a word we don't use very often, so I wanted to make sure we identified it. It's a list of medications as covered by an insurance company. In this case, the single Medicaid formulary is all the insurance companies, the Medicare managed care organizations or MCOs that provide Medicaid services, as well as Medicaid itself. Currently, every MCO has a different formulary. Medicaid fee-for-service has another one. These separate lists have caused a lot of chaos and confusion for patients and providers in identifying what medicines work for someone and what will be covered as well. Senate Bill 50 was passed to require a single formulary to be created and adopted by all the MCOs and Medicaid. This is our hopes with that is that it will compress everything into a single formulary that will be modeled off of the Medicaid fee-for-service, which providers are already familiar with, and so that we can move forward together. The single formulary is supposed to start January 1st of 2021. Next slide, please. All medications patients are currently receiving will continue to be covered, regardless of whether or not they're on the formulary or on the preferred drug list. Preferred drug lists are kind of like the shorthand. This is our first choice from an insurance company. No step therapy or fail first requirements will be set for behavioral health medications. We have been assured many times now, and I hope that that continues to be true. Future advocacy around medications and medications classes will be with a single pharmacy and therapeutics committee. They've had a separate one for each MCO and for Medicaid for all this time, and we've had to advocate for changes at each individual one. So putting it into one place, one voice, one place to target all that action is really important. It simplifies the process, and we hope it'll all over the place that this will improve access. And on to Sheila Schuster.
Thank you, Marcy. Good afternoon. I'm Sheila Schuster. I'm the Executive Director of Advocacy Action Network, which is comprised of the Kentucky Mental Health Coalition, the 874K Disabilities Coalition, the Medicaid Consortium. Next slide, please. So I wanted to talk to you a little bit about this session that's coming up. It's starting on January 5th. The session always starts on the first Tuesday after the first Monday in January. So think about that. So kind of an odd way, but it will be on January 5th. And this is a short 30-day session. So typically it's very difficult to pass anything new or anything controversial in a short session. And for the first time in the, I believe in the history of the General Assembly, they have to pass a budget during this 30-day session. And that's because typically they do a biennial or 2-year budget in the even numbered sessions. But about halfway through the 2020 session, we were hit with the COVID pandemic. And I think the legislators wisely declined to do a second-year budget. They had to do a budget starting in July of 2020, but they were so concerned because of the unknown about what the revenue projections would be, what the COVID-19 cost would be, and what the economic future for Kentucky was. So we will have to do a budget in this 30-day session, and that's the #1 priority for legislators. Their other priority, and we have a supermajority of Republicans in both the House and the Senate, they have been very upset, concerned, negative about some of the actions that the governor has taken through his emergency powers, closing down schools, closing down bars and restaurants, putting a mask mandate in place, and so forth. And so there's much talk and several pre-filed bills where the Republicans are threatened to pass legislation to restrict the governor's emergency powers. Interestingly, the courts in Kentucky so far have taken the side of the governor when his emergency requirements or mandates have been challenged either by schools or by businesses. And I'm guessing that this issue is likely to end up again in the court system, depending on how they go about it. Some of the legislative issues for you to look for that we're pretty sure are going to get some traction in this session. One is an absolute favorite of mine, and that's mental health parity. We're so glad through the ACA, particularly, to have health insurance plans and Medicaid cover mental health and substance use disorders, but they don't always treat the mind part of insurance as well as they treat the body part. So there are sometimes higher copays and coinsurance. There's sometimes lower lifetime and annual limits. There's restrictions sometimes on number of visits or days in the hospital. And so we passed a parity bill in 2000 that was pretty solid. It was actually a forerunner of the federal parity bill that was passed in 2008. But we also know that the insurers are not following it. So this bill was brought to us from the Psychiatric Medical Association, and we've done a lot of work on it during the interim. And it will require the insurers to file with the Department of Insurance the paperwork on which they are basing their parity. And that gives the Department of Insurance the ability to really regulate those insurers in terms of parity. Another thing that we'll see is that telehealth has been used, telemedicine they call it, telepsychology they call it, depending on who's doing it. But the use of platforms, Zooms, FaceTime, even telephones to get your healthcare services, whether physical health or mental health. And the rules have been relaxed by CMS in Washington and by our own Department for Medicaid Services and Department of Insurance. So some of this has been so successful that the legislators want to put it into statute to keep telehealth a viable means of delivering health care. We want to be sure that providers are paid the same for a telehealth visit as they would be paid, for instance, for an in-person visit. And we want to make sure that it's as accessible as possible. We know that there still are big chunks of Kentucky where there is not good internet coverage. So we're really advocating that telephone be available and other means of telehealth. Due to the Breonna Taylor case and some other issues like that, there are a number of bills that have been filed around criminal justice reform. Representative Attica Scott has filed a bill to ban no-knock warrants, which was used in the case of Breonna Taylor, and they're calling it Breonna's bill. I think there also will be some continued work on trying to get rid of or trying to change the cash bail system. We know that we have people that are stuck in jail because they don't have the cash to pay their bail. And it typically has racial implications because many of the folks are people of color. Something that we've worked on through KBH and our partner organizations is protections against surprise billing. And that's what happens to a consumer when you very carefully pick a hospital that's in your covered network and you pick a surgeon that's covered, and you have your surgery and you get home and you have this huge bill that comes from a radiologist or an anesthesiologist or a pathologist, people that you receive services from that you had no control over, that were probably under contract with the hospital. So we're working with several different legislators on different approaches to this, with the purpose of, or the goal of, holding the consumer harmless and letting the rest of the people fight about who's going to pay the bill or get stuck with the bill. We also have been very concerned, and you've heard it from the governor at his news briefings on a regular basis, and that is the racial disparities that exist in Kentucky and elsewhere across the country. We're seeing many more persons of color being affected, for instance, by the COVID pandemic, getting much sicker with it and sometimes dying at alarming rates. We're also seeing this in maternal mortality. And so we want to look at that and see if we can at least get some monitoring going on around health disparities. And then the racial injustice that we feel in the Commonwealth and in other local communities. I'm not sure we could legislate justice, but I don't know why I've gotten an echo. Okay. But we're hoping to see some moves toward assuring some racial justice in the Commonwealth. Next slide, please. So the election gave the Republicans more seats in both chambers. So there was a pickup of 2 seats in the Senate, where they now hold a majority of 30-8, and picked up 13 additional seats in the House, where the majority is 75-25. So super majority in either chamber is 3/5 of the number. So people are now referring to this as the super majority. Do not be discouraged if your House member or your senator is a Democrat. They still have a vote on all bills in the chamber. They still have a vote on the committees. And many of them have done a very good job of working across the aisle with their Republican counterparts. I would venture to say that most of the issues that the Thrive Kentucky group are interested in are really not partisan issues. They may be approached differently by Republicans than Democrats, but health is not a partisan issue. Economic justice can be perceived differently depending on party, but solutions, I think, can be agreed to in a bipartisan way. I want to alert you that there will be 28 newly elected legislators coming to Frankfort on January 5th. There will be 6 in the Senate and 22 in the House. 2 of the ones in the House are actually returning legislators who were defeated and then won their seats back. But they'll be the legislators that look like deer caught in the headlights when you see them on KET and so forth. So I want to really encourage you to reach out now to introduce yourself as a constituent. If you have a newly elected House member or senator in your neck of the woods, they're looking for friends, whether you voted for them or not. They want to know that you live in their district and that you are a constituent. You are the most important person to them as a constituent because you could vote them in or out at the next election. This session, which is short, but it has 2 parts. So the legislators will come in for the first week of January, and then they go back home for 3.5 weeks and won't come back until February 2nd. They work then until the session adjourns on March 30th. So that time back home is just an absolutely great opportunity for you to arrange to meet with your legislators, to discuss your issues, and to ask for support. And I will tell you that legislators are arranging Zoom meetings, or they're doing conference calls if you have several friends that want to meet with a legislator at the same time. You can also do socially distanced meetings with them in the district. But this is a great time when they are not quite so busy. When they come back on February 2nd, they'll have a budget to pass again, and they'll have probably 600 to 700 bills to digest. So remember that time back home. And I would also warn you that we're going to have to work extra hard to be heard, because in all probability, we will not be allowed in Frankfort, certainly not in any great numbers. So those of you who are used to being able to go and meet in person with your legislators or to testify in person, we're not sure what the accessibility is going to look like. Through Thrive, we drafted a letter to the legislative leaders, President Stivers, Speaker Osborne, Minority Leader McGarvey, and Minority Leader Jenkins. It was signed on to by, what, Emily, 110, 112 different organizations, which was great. And so we have sent those off. We also did a parallel letter to the governor asking about accessibility over in the Capitol, to the rotunda, and also to the galleries in the House and the Senate. So stay tuned. We will let people know when we know what the accessibility will be. And lastly, I'll put a plug in. Every year I do advocacy training, and I will do that again on January 11th. It'll be on Zoom from 1 to 3. It's essentially Advocacy 101. It's free unless you're a mental health professional and want CE credits. So we will get that information and the registration information out to you. I would love to have you join or spread the word. It's pretty basic how-to, and I'll have a legislator or two also to talk to you from their perspective. Thank you very much, and I'll turn it over.
Sheila, I added this slide at the last minute and just wanted to do a plug for KVH's annual legislative forum, which is on Friday, this Friday, December 4th. There's information here about the topics and the legislators who will be speaking on our panel, and Sheila will be moderating. So
I was going to say, I recognize those pictures. So yes, we have done this probably, Emily, at every annual meeting the KVH has done. And I think it's always one of the best received by the audience, because you really get to hear from legislators in a one-to-one almost kind of information session. Also at the registration, you can submit questions that you want legislators to be asked. So we encourage you to register and send in your questions. Thank you.
yes, I'll make sure the link is in our follow-up email. All right, so we'll turn it over to Kara next.
Hi, I am here to be the broken record every month that to have nice things, we have to ask for them. And the place where we need to ask is also unchanged, Washington, D.C. You know, so just a super quick overview. Remember, we had a law that happened in March. We had we've had more passed since then through one chamber. We haven't had anything come together across both chambers, but today, this morning, we have yet another opportunity. We have another compromise bill. Emily, can go to the next slide. That has been filed. This was introduced today. We don't know everything about it because, again, it was today, but we know it is essentially the third compromise, and that it has come from the Senate this time, which is even a sort of a more hopeful piece of information, because all of the other compromise proposals have been coming out of the House. So this has come out, a bipartisan bill from the Senate, which does not have enough money in it, but as Senator Durbin said today, let us not make the best the enemy of the good. So that is where we are right now with that. And my ask is the same as always, make it happen. Let's make our phone calls, leave the messages, get in touch, remind the people that they are representing you. And of course, my reminder, which follows on what Dr. Schuster said, they represent us. And if we aren't telling people what that means and how to do it, then they can't. So, and I'm sure that most people on this call have called some of our federal delegation, including Senator McConnell and Senator Paul, plenty of times. But let's do it again and say that we need federal relief and we need a bill to go through. So that's where we are. And I thought when I woke up this morning, I thought we are in a more slightly less optimistic situation, that there wasn't anything else on the horizon to actually push for, and we could just be making some phone calls. But then late morning, there we go. We have an opportunity to push through something specific, which is this new COVID emergency relief framework. This, what you see on this slide, which of course you will get in a way that'll be easy to read, this is what we know about it thus far. We know that it's not nearly enough, but it's the money for things that are desperately, desperately needed, especially that state, local, and tribal government number there, and additional and
Kara, I think we just lost your audio. Or at least I can't hear you any longer. I'm not sure if others can.
I can't either. Cannot.
I think she froze. Oh.
No, it seems to be an audio issue. I'll just say that unless Kara can get it working again, this is information that just came out today. We can share updates as we get more, but we really do think that while this is not enough, it is what we desperately need relief now, and we need to first get something like this passed and then keep working on another bill for more federal relief under the Biden administration. But during the lame duck session, this is an opportunity that we don't want to pass up. So here's information for calling our Senator Mitch McConnell and Majority Leader. And we want to make sure that he hears from Kentuckians about just how desperately we need this relief. And with unemployment benefits already decreased and soon to end, it's even more important now than ever, especially as the holidays are coming and COVID-19 infection rates are increasing. So I will just wrap things up with some resources, which we try to share at the end of all of our webinars. This information is largely the same as what we've shared in the past, but there are a few new resources. It's just a good go-to if you want information about various assistance programs that are specific to COVID-19, housing, food assistance, utility assistance. There's a great reentry guide that the ACLU has put together that you can see here, mental health screenings. I believe that the Team Kentucky Fund is either almost depleted or it will be ending soon, but we'll try to get more information for you on that in January. If you are interested in policy and want to know the latest on what's happening with Medicaid, SNAP, or COVID-19, Dustin Pugel with the Kentucky Center for Economic Policy has done an excellent job of keeping these various trackers updated. And you can go and see the latest numbers here and any major policy changes that have happened. And then we've talked about the need for legal aid assistance, particularly right now in housing. Here's information about the legal aid programs throughout the state and contact information. There's a link to see what's covered in each county, and then stimulus checks. There was an extension that was with the $1,200 stimulus checks that came out earlier this year. Not every Kentuckian has received their stimulus check. If you don't typically file your taxes, then you are probably not going to receive that check without completing this tool. So we want to make sure that Kentuckians know that that's available. Is it actually, Dustin, has it actually expired?
It has, yeah. November 21st was the deadline.
I'm sorry. We should have taken that off the slide. We are expecting, if this new legislation passes, that another stimulus check will be included in it.
Although we should say, I was going to bring this up during Kara's section, but stimulus checks are not currently part of this proposed bipartisan bill. So that was a very helpful thing to for folks in general, but it was also very helpful in stopping the drop in consumer demand, which then helped make sure there weren't further layoffs. So I would encourage folks, if they do make calls, to ask for another round of their stimulus checks too, because I think that would be very useful to a lot of folks, not just to meet basic needs, but also to ensure that we don't end up laying more people off.
Yeah, thank you for correcting that. And there has been a lot of interest, especially with the Trump administration, in doing a second round of stimulus checks. So we hope that that can happen during the lame duck session. Food assistance, these are links to various programs that people can reach out to if they need something in addition to SNAP or the pandemic P-EBT. And then we are still collecting stories about the importance, the value of Medicaid and Connect having coverage. And so if anyone is interested in sharing their story, we would love to talk to you. You can reach out to me. And I wanted to make sure that everyone marks their calendars for our upcoming session, our upcoming webinars that will be during the legislative session, because there are lots of committee meetings and other things that go on during the General Assembly on Tuesdays. We are moving our dates to Mondays, the first Monday of the month in January and February. They'll still be at 2 p.m., but they'll be on Monday. So I will send out registration links for those soon. We had our first quarterly forum with the Cabinet for Health and Family Leadership in November. And so our second forum will be February 1st. So we would love to get questions and topics of interest from folks so that we can make that a really valuable forum for everyone. And we already talked about the legislative forum coming up on this Friday. We'll send out a link to that. Sheila mentioned the Advocacy 101 training that she does. It's better to participate live if you can. So the one in January is great. If you can't make it, we have a recording here. And it's just a great reference for advocates. So again, if you are a licensed social worker or a certified community health worker and you'd like CE credit for participating in the webinar today, you can email Kelly at this email address. That'll be in the email that we send out as a follow-up. And we have, I think, a little bit of time, 15 minutes for questions, if anyone has them, or we can end early today. Have I missed any questions that have been in the chat? I'll give it 1 minute for some last minute questions or anything that someone may have forgotten to share earlier before we wrap up. All right, well, thanks everybody for attending. Hope you all have a good afternoon and we will see you again in January. Yep.
What was that email address?
The email right here, Kelly at kyvoicesforhealth.org. There we go. All right. Thanks, everyone. Have a good day.
Thank you. Bye-bye.